We are a top-ranked pediatric cardiology program that serves a large population. We do the most transplants in the state, and we have one of the largest imaging labs in the country where we perform over 20,000 pediatric echocardiograms per year. Hi, my name is Angira Patel. I'm the program director of the Non-Invasive Imaging Cardiac Fellowship here at Lurie Children's Hospital. As the program director, I think of my first responsibility as someone who creates an environment where the fellow can thrive and learn. And we do this intentionally by working with everyone that you're going to interact with, including our head of fetal cardiology, our head of MRI, all the sonographers, as well as all the attendings. The Division of Cardiology is very large. We have over 55 faculty, and within imaging, we have over 20 sonographers as well. This creates a robust system that allows you to be mentored and do research with a wide variety of people. We practice adult learning. We tailor our fellowship to the fellows that come into our program. Certainly at the beginning of your fellowship, we want you to be exposed to all the imaging modalities. So of course, transthoracic echoes, transesophageal echoes, 3D, MRI, fetal, and strain imaging. However, as you progress through the fellowship, approximately around month 4 or 5, we have a discussion. We sit down. We think about what it is that speaks to you, what is your passion, and we transition at that point to becoming subspecialized in maybe 1 or 2 imaging modalities. You're going to see the most complex patients. You're going to see every surgery. You're going to see every modality, and it's going to be harnessed by people who are experts in those fields. So it's really important in terms of becoming an imager that you have access to all the complexities, and we have that at Lurie Children's.
Hi, I'm Nazia Husain. I'm the medical director of the cardiac MR and CT program within the Heart Center at Lurie Children's. We're a pretty high volume cardiac MR CT program in pediatrics, and we do about 1,000 pediatric cardiac MRIs and about 400 cardiac CTs, and that makes us a very strong place for trainees to come and learn about cross-sectional imaging for pediatric cardiology fellows who are seeking training in advanced imaging. We have a really long-standing, unique relationship with radiology and work with them very closely, and the trainees certainly take advantage of that collaboration and relationship to learn technical and clinical aspects of cross-sectional imaging from both the radiologist as well as the cardiologist. There's some unique things that we do in the program. We perform cardiac CTs and train our trainees to learn how to do that, which is not available in a lot of other programs. And we do some advanced testing, including doing stress cardiac MRs, which is not routinely performed in a lot of centers. And there's a pretty strong research collaboration with Northwestern, and that allows trainees to take advantage of those opportunities to develop their own academic careers. We really want advanced imaging trainees to be very good non-invasive imagers and to have very successful academic careers at the end of their training.
I'm Sheetal Patel. I am Interim Director for Fetal Cardiac Program within the Heart Center and Chicago Institute for Fetal Health. I get heavily involved in planning the 4th year imaging fellowship within the Heart Center. So our goal for the imaging fellow is to start out with learning the skills of fetal cardiac imaging, but then they progress pretty quickly to counseling the parents, be involved in making delivery plans, and collaborate with our other specialties such as neonatology, maternal fetal medicine, to see through the delivery plan that we have individualized for each fetus. Our Chicago Institute for Fetal Health provides great platform to take care of these complex congenital heart defect fetuses, but also some fetuses who have heart problem as well as multiple other anomalies, which makes the delivery planning more complex. We perform about 2,000 fetal echoes per year, which provides great variety and also high complexity. Apart from the taking care of congenital heart fetuses, our fellows also get involved in other fetal interventions such as evaluation for twin-to-twin transfusion, because we are one of the centers that would offer that fetal intervention for TTTS, for ablation procedure. Our fellows also get involved in fetal MMC repair monitoring. So there are a few unique things in our program that exposes our fourth-year fellow to do cutting-edge evaluation process.
I recognize that a one-year fellowship is a very, very short time to be productive in research. So one of the things we do is that we meet with our fellows even before they arrive in Chicago. Those last 3 months of their categorical fellowship, we have phone meetings, we have Zoom calls, we introduce you to research that speaks to you and mentors so that by the time you're here in July, you already have ideas of what your research project is going to be. Because my goal for you is that you present at a national meeting. My goal is that for you is that you have a publication soon after you finish with us. And that takes intentional planning before you even get here. There is an institutional effort, not only at Lurie Children's Graduate Medical Education, but also within the Division of Cardiology. We think about health disparities and outcomes in cardiology. We think about social determinants of health and how to overcome those and how they impact care. And we also think about ethical principles that affect how we care for children with congenital heart disease. The other unique aspect of training at Lurie Children's is the access to Northwestern medicine at large, which supports any interest that you might have in other areas of medicine. Thank you so much for taking the time to listen to us. I look forward to meeting you in the future and telling you more about our wonderful program.